Crohn's disease is a lifelong inflammatory bowel disease throughout parts of the digestive system, from the mouth to the rectum. The most common site for this disease is the terminal ileum, which is located between the last part of the small intestine and the first section of the large intestine. There is no known cause for Crohn's disease. Researchers believe a number of factors play a role in the development in Crohn's disease, including heredity and a malfunctioning immune system, which can cause the immune system to attack the cells in the digestive tract. Although Crohn's can occur at any age, it most commonly occurs in teenagers and young adults. The symptoms vary from mild to severe. Diarrhea occurs because the intestinal cells secrete large amounts of salt and water, and because the colon cannot absorb the excess fluid, the patient develops severe diarrhea. Abdominal pain and cramping are caused from inflammation and ulcerations, which causes the wall of the intestine to swell and scar. More severe cases of Crohn's will cause severe nausea and vomiting. Blood in the stool is caused by a bleeding, inflamed tissue of the digestive tract, which will cause a dark or bright red stool. Patients can also have bleeding that can't be seen, which is called occult blood. Most patients will become anemic. Ulcers from Crohn's disease can cause sores on the surface of the intestine that can eventually get so large they penetrate deep into and through the intestinal walls. This can cause absorption issues. The small intestine is where most absorption occurs in the body. Patients may also experience weight loss due to cramping and abdominal pain from the inflammation in the wall of the bowel. Additional symptoms include fever, fatigue, arthritis, delayed puberty, skin rashes, eye problems, mouth canker sores, poor growth, and a higher risk for certain cancers. There are several steps to diagnosing Crohn's disease, including lab tests, stool samples, CT scans, colonoscopy, video capsule endoscopy, X-rays, and fluoroscopy studies that include the barium swallow, which examines the esophagus to the stomach, a modified barium swallow, which is an examination of the mouth to the pharynx to the esophagus. An upper GI includes the esophagus, stomach, and the upper part of the small intestine. A small bowel follow-through focuses on the esophagus, stomach, and the small intestine. Barium enemas include the large intestine and the rectum. The best diagnostic tests are barium studies conducted under fluoroscopy. If there is a suspected obstruction, an iodine-containing agent, such as gastrografin, should be used. There are several radiographic signs to look for during a patient's fluoroscopic procedure. One of them is a string sign. Because there is so much inflammation in the intestine, the barium has a small area to pass through. This will look like a string of barium going through the part of the intestine that is affected. Another radiographic sign includes a cobblestoning pattern and disperses barium between inflamed edematous mucosa, which is the swollen parts of the lining in the GI tract. To detect ulcerations, barium will collect in the ulceration surrounded by the thickened mucosa, or the lining of the gastrointestinal tract. Nodular fillings will fold in the ileal mucosa, which is the lining of the ileal wall, and is a sign of Crohn's disease. The main focus to treating Crohn's disease is to reduce the inflammation, finding out what triggers the inflammation, and maintain remission once the inflammation is reduced. Severity of the Crohn's disease symptoms is what determines the treatment. Treatment varies from diet and medications to surgery in severe cases. Surgery is avoided because the disease may reoccur even though it appears that all affected areas have been removed. Surgery may include removing fistulas, stretching of strictures, removing parts of the intestine, and resectioning the entire colon, which requires the need for a colostomy or ileostomy. Medications can control the inflammation and is the treatment of choice. After the inflammation and symptoms are under control, the main goal is sustained remission and avoid surgery. This can be obtained by using medications that may suppress the immune system but can be used for long periods of time. Keeping a logbook of possible foods that may trigger the inflammation to the gastrointestinal tract is one key way to avoid a flare-up. Taking vitamin supplements and increasing calorie intake may help with weight loss from the chronic nausea associated with Crohn's disease. Nutrients are not absorbed as easily if there is inflammation or if part of the intestine has been removed. A healthy diet developed by the physician and the patient is best when trying to manage this debilitating disease. Patients may seek counseling regarding the psychological effects of Crohn's disease by contacting the CCFA by email at florida@ccfa.org.